administration will not implement the CDC's 17-page draft recommendation for reopening America, according to a senior CDC official. The same official told CNN, quote, a team of people at the CDC spent innumerable hours in response to an ask from Debbie Birx, end quote. Why are those guidelines not being used? And even the guidelines that you put out for the coronavirus task force for states, according to testimony, most of the states that are reopening have not actually met the criteria that you set out.
Now you see how they're building the narrative? Well, why aren't they paying attention to, the guidelines to reopen, Because it's obvious, man. They're setting it up so that she can say, whether she says, they should be paying attention because, what happens if this happens, whatever. But they're showing you something big is about to happen by telling you nobody's paying attention to guidelines. What do you have to say about that, Mrs. Teeth?
So thank you. There's two questions there. One, we're in deep partnership with CDC, both for the White House guidelines that were put out on how to open up America again, but also the details behind the guidelines. And we're working with the CDC on a whole series of products, from how to improve community mitigation, what to do about contact tracing, how to improve surveillance, and certainly these more detailed guidelines about childcare and camps. And those are still being worked on. No one has
childcare and camps? Excuse me?
Stop those guidelines. We're still in editing. I just got my edits back from the CDC late yesterday. I'm working on them as soon as I get off of this discussion. So we are in constant work with the CDC and really value their partnership. And as you know, they put up guidelines quite often. They just did a Meatpackers guidelines. And so I really want to appreciate how proactive they have been in working with the White House and really ensuring that the best science is put forward, both in our White House guidelines, but also in the guidelines that they post on the CDC website.
Is that what guides the edit science? Because it seems like from some of the comments coming out about these guidelines that it's also, political beliefs, religious beliefs. I mean, is it scientific? Is it scientists who are making the edits?
Well, I like to believe that I'm a scientist, and I've been working with the CDC on the edits. It was more about simplification to really make sure that both the American people as well as public health officials understand the guidelines, and then really working on a whole area on surveillance for asymptomatic individuals. And that was a very new element that we felt very strongly had to be included because of the ever-increasing evidence of asymptomatic spread.
Dr. Birx, as you know, one of the valets at the White House tested positive for the coronavirus. And I'm curious, I know that there's, I'm sure, discussions about protection of the president. You think of that as being a Secret Service thing, but have you offered some guidance on how to best protect the president, the vice president, in terms of not contracting the coronavirus? Because I understand, masks aren't being worn. I know that they're being tested more often, but the point would be not to get infected. What are you advising them to do?
Well, I think for anyone who works in the White House, when you are sometimes with the vice president or president, I think all of us are very nervous every day. None of us want to be the one to ever bring coronavirus into the White House. Most of us don't do anything but go to work and come.
Yeah, the problem is that it'll never be brought into the White House. And if it is brought into the White House, it'll just be hearsay to scare people, to make it look like they're vulnerable, because people are speaking out like me, saying that they're being negligent if it was real.
If we go out at all, even to take a walk, I could assure you we do wear masks in public, and we do very...
Yeah, and that's a lie, because didn't he just go to a factory where they're making masks and he refused to wear them? They really think we're this stupid.
Very exquisitely social distance. But every day, when you're running around, you're always asking yourself, did I forget to wash my hands? Did I use hand sanitizers? Did I touch someone's phone? Did I touch someone's chair? And I know that the American people are thinking this themselves every day. And it's...
No, actually, I'm not. I'm thinking about how much I want y'all to get the fuck out of the goddamn earth.
difficult to constantly remind yourself to be careful where your hands are, to not touch your face, to make sure you're washing your hands, because our hands touch a lot of things. And I think that kind of constant awareness that we all have to have in order to just protect ourselves from getting infected, but critically to protect others from getting infected.
But wouldn't you tell people to wear masks then around the president? I mean, just based on what you said, even if you're really diligent, you might still inadvertently get infected and pass that infection along.
Certainly there are people who wear masks on the White House complex. I'm very scrupulous, and I know all of the meetings we have are very much focused on social distancing and ensuring that we maintain that separation. Sometimes in meetings in the Oval, it's more difficult, but we really concentrate on this, and I think that we all are very concerned about protecting others as well as ensuring that we don't become positive ourselves.
Dr. Birx, more than half the states in the country have either started to reopen their economies or planning to do so in the near future. Most of them, as I said before, failed to meet the criteria that you and the Trump administration have recommended. You put out those 3 stages. They're not following that. I mean, are those things just now irrelevant?
Well, I don't believe they're irrelevant.
Sound like he was about to say, are there going to be consequences to that? But he knew that wouldn't sound right.
I work with governors every day to really make sure that they understand each of the phases, but critically to make sure that also the American people are going to the website and looking at what they can do to protect themselves. In all the first 2 stages, and very seriously, I just want to mention this again, it's really about ensuring we protect the most vulnerable among us. And so we have still asked for all of the individuals with comorbidities or other conditions that would make them more susceptible to a more serious disease to continue to shelter in place. And for those that interact with those individuals with comorbidities to be absolutely scrupulous in their hand washing and in their making sure that they're wearing masks in public and making sure that we're protecting those individuals.
But are any of the states that are reopening, have they met your criteria?
Well, we've told them that they could meet the criteria county by county or at the whole state level. And I can see counties across the United States and in every state that meet the criteria. And so when you see what Governor DeSantis did, he had counties that met the criteria, and those are starting to open. He kept Broward, Palm Beach, and Dade closed and not reopening for that very reason. And so we're constantly advising the governors.
Right, but that's not happening in all states.
Their states.
Right, but Georgia is the governor made a statewide order for how to reopen, and they don't qualify to your standards.
Well, I think you saw strongly our response, both my response and the president's response to Georgia. And I think to the people of Atlanta, we still ask you to follow your case numbers and really ensure that your cases are starting to go down before you start to relax any of your diligence or social distancing. This is really for all Atlantans to listen to.
I have to say, Ambassador Birx, sorry, I live in Georgia, and as you may have also heard, the University of Maryland released a study saying 62,000 people came to the state because the restaurants were open and barbershops and things like that. I mean, that's a problem, right? I mean, how do you do this state by state or even county by county if people can still move around when you're dealing with a contagious virus? I mean, that puts people at risk, maybe as they're coming out the backside of the curve.
Well, I think it also puts themselves at risk, those who chose to come into an area where we know that there is still circulating virus. And that's why I've asked every state to not only, and I'm sure they're very diligent about their individuals and the governors are concerned about every member of their state, but I've also asked them to really make the data available to the public. And so whether you're in the state or outside the state, you can really see what's going on. And I've been driving people to the Florida site. I really want to work with every state governor to make this data public facing so that everybody can see where the cases are, where the hospitalizations are, where the testing is available, and where the state fits and where that county fits in the most granular ways so that people and the citizens of every community can see their own individual data and be able to interpret the federal guidelines and ensure that protecting themselves.
Yeah. All I hear is bullshit, 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 lies, 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 bullshit, bullshit, bullshit.